Okay, so John, at this point you are a strength and conditioning coach over at UCI.
Yes.
What kind of athletes do you help with this?
So
Your expertise?
as of now, I've worked with men's water polo, men's baseball, men's women's track and field, cross country. And I think, hope I'm not missing anybody. I think that's it. I've worked with a few teams, so
That's a problem you have when you're constantly working with athletes and your whole life is fulfilled with that. Now, on the other side of the spectrum, I treat people who injure themselves being active, or treat people who injure themselves not being active, because believe it or not, you can get hurt just sitting on your chair behind a computer, and unfortunately we see too many of those cases. Or there are people who have a sedentary lifestyle throughout the day, and then they go to a gym and they have an issue there, injuring themselves. So the purpose of doing these duo presentations are coming from basically from the two perspectives of the spectrum, where people either have injured themselves being active and now they need to be rehabbed. Then John gives his perspective on as an athlete and as a strength and conditioning coach as to what to do when you're rehabbing the area, when you're working out how to not injure yourself. I think that's the key. If you don't get hurt, that would be the most ideal. And then from my perspective is some of the things that you need to watch out for as far as injury prevention and rehab is concerned. So John, when it comes to upper back and shoulder area, and what we mean by shoulder is this is shoulder, this is your upper back, this is your upper back. So a lot of times people refer to the top of their torso as the shoulder. So just to clarify, all of that area, all of these areas are the focus of today's presentation. John, let's talk about an active individual who is just wanting to build the muscles and the shoulders, which is typically a lot of men. I've noticed a lot of men are working on their serratus anterior over here, which technically, if someone comes to me and says, I really want to build a serratus anterior, I know they're just very vain, because the serratus anterior is not meant to be buffed necessarily. So from that perspective, what's the number one thing in your opinion that they need to be aware of before they start working out as far as joint positioning is concerned?
I think people should be aware of what they should be able to do first before they go into working out, so they know, okay, if I can't do this, this is an issue. If I can't do this movement, this is an issue. So first, I think we should address what the ranges of motion that your upper back should be able to go through on a day-to-day basis. So what I mean by that is, so we're talking about the shoulders and the upper back. Shoulders and your upper back entail your scapula, your T-spine, which is mid-back right up here between your shoulder blades, and your shoulders. So what we want to do, the scapula are meant to protract and retract.
Just to let people know, scapula is the shoulder blade.
The shoulder blade.
Yeah.
My fault. So scapula should be able to retract and protract across your T-spine, pretty effortlessly. You should have a good range of motion in both directions. I feel that a lot of people are at desk jobs, or if you're not at a desk job, you are on the computer or doing stuff that's in front of you. So we get into this kind of pseudo protracted position, and we're kind of stuck there a lot more often than not. And so this isn't necessarily protraction, it's kind of stuck in
rolled forward
instead of, you kind of rolled forward instead of protracted forward, if that makes sense.
That makes sense, but one thing I want to emphasize, and I know what John means, but in translating it into a language that what I see in the practice, because you deal with athletes, they're familiar with the terminology, so to speak. You have to understand your pecs will pull your shoulders forward, but then your pecs don't push your shoulders back, though I do see in a hyperactive, very talkative type of pec when it's just like that. It's very easy to activate the pecs to initiate the move going back. So when you're doing moving the pecs forward, your neck needs to be in the right position. You're not moving your torso front and back, so be watchful for that. You're engaging your pecs to contract and roll your shoulders forward. And then you need to really engage, John, if I can use you for a second. You really need to engage these muscles to pull it back without, and really it's very easy to go to the big muscles to try to retract your shoulder blades and push your chest forward. You don't want to necessarily do that because there's so many muscles that come before them. So you want to be able to go from the rolled forward to neutral to then engage this to go back. Make sure you're not using your elbows to initiate the posterior moves, the backward moves, or you're not using the right muscles, right?
Yes, yes.
A lot of times people are too busy trying to deliver a mechanics backward movement using whatever it takes. We're not using anything or everything that, whatever it takes to pull it back, but so don't use your elbow to initiate the backward movement. Watch out for that. That's how you rehab the right muscles, right?
Yeah, so along those lines, like Dr. Shakib said, you don't want to use your elbows to protract or retract your shoulders. I see a lot in the gym people doing rowing movements where you're pulling something towards yourself and they're still in this position, but they think because they're bringing their elbows back, they're working their back. The only thing you're really doing is kind of aggravating the front of your shoulders and your bicep tendon, because when you're in this kind of stuck position and then you roll back, I'm putting a lot of stress right here in the front of my shoulder. So we kind of want to get away from just the arms moving and get used to moving our shoulders and our T-spine.
One thing from the treatment aspect of shoulder injuries is concerned, I can't say 100%, but pretty close to 100% of cases, all shoulder injuries I see in my practice, they come with short forearm muscles, because you have to understand, if you don't have equal length on both sides of your forearm, one side's gonna pull a little bit, almost like your armpit closer to your hands, and so any type of exercise you do for your shoulder joints is gonna be uneven. And then the other thing that you have to understand is, as John was showing with like rowing type of exercises, a lot of times people are using the same muscle, one in the front, pretty much one or two in the back, to do this rowing exercise, when in reality, everything that is engaged with the movement forward, not just pecs or your biceps or pushing with the triceps, that's another one I see a lot of, but also when they're going back, it's so common to use, I would say a lot of rhomboid, wouldn't you say?
Yes.
Rhomboid is right in between here. So I see a lot of that and a lot of lats here,
Yes.
but not enough of like infraspinatus, which is lower part of your scapula here, or supraspinatus. All of these have to be engaged, otherwise you're overdeveloping certain muscles and you're still imbalanced.
Yes. So yeah, it's perfectly said. I see this a lot with athletes who want to press a lot of weight, so like a bench press or like a dumbbell press. We're taught a lot, and I tell my athletes as well, pin your shoulders back, which is going to put your shoulders in a safer position to press a lot of weight, because that's our goal. We're not looking for health in the sense of finding a better movement pattern. We want to press weight, but at the same time, I don't see enough people training that serratus anterior and that protraction equally as much. If we're just pinned against so if we have the bench behind us and we have our shoulders pinned back, our serratus aren't working, we're in that retracted position, but at the same time it's a little false, and we gotta still move through both ranges of motion with those pressing movements.
Pinning the shoulders back, actually, from my perspective, is a scary term to use. And I'll tell you why. Because when I don't use that term because I stopped using that term. Because when I have people pin their shoulders back, they automatically push their chest out.
Okay.
we don't want to do that either. What is a good exercise in your opinion? I feel that serratus anterior, which is, do you want to explain what serratus anterior is?
So your serratus anterior is like a muscle that comes around your front that's meant to bring your scapula shoulder blades out.
It's a shoulder stabilizer.
Yes.
So if you've got your shoulder blade, you've got your shoulder blade here. So I'm going to remove the shoulder blade. Now you're seeing the inside part of the shoulder blade. There is a muscle that goes on the inside part of your shoulder blade. That's called serratus anterior. And then it goes and it has its fingers going to the side here. So its role is to stabilize your shoulder blade from winging out too far. So I see that a lot of times either overstretched when people are typing and their elbows are out, or a lot of times it's squeezed too tight because people are not paying attention to the relaxation here. So even with athletes, a lot of times I've noticed, depending on the sports, they use their elbows in to use their body back, and then they're overactivating their serratus, so to speak.
Okay.
And then it doesn't have that nice mobility it should have.
Yeah.
So either way, either you squeeze it to death and it gets weak, or you stretch it so much that it doesn't have the strength, it gets weak. So what would be a good strengthening exercise, not to buff it up, so when you're looking you see all these fingers here. I mean, that looks fine, but whatever. I'm more interested in the rehab in it.
Yeah.
What would be, in your opinion, a good exercise for that?
So I think we need to be speaking to two different people. Like you said, it could be have an extra wide range of motion, be winging and be weak, or it could be stapled down and not moving and stuck.
Good point.
So for those two people, I recommend two different things. If it's stuck and you're not be able to move it, one thing I like to do is just hang from a bar. So if you go up to like a pull-up bar and you just hang from it and really sink, you're gonna get a little more of that movement up into the bar and be able to relax a little bit more.
I see that. I see so many other muscles come into play in that picture. So I'm not sure if I would feel comfortable trusting that it's going to get done right.
That's the thing too. That's why I saw it here, is because if you're hanging from a bar and you don't do it right, you'll probably know you're not doing it right, and then you can tell me you're not doing it right, and then we can move on to something else. But the only reason I don't like recommending something else like a prone push-up, where you kind of force yourself to.
I was just gonna say prone push-up is probably the one I go to.
Yeah, it's because if I can't see you, and a lot of athletes tell me they're doing it right, but then I'll see them and then I know they're not doing it right. And so then I know we're kind of reinforcing that bad motor recruitment pattern. But if we're hanging from a bar and you're not doing it right, I feel like the damage is less if I'm not able to watch you. That's kind of why I go to the pull-up bar first, if that makes sense.
So I hear you, but from my perspective, so here you are seeing a discrepancy or disagreement or having two different opinions on the same subject. So from my point of view, I go to what most people's tendency is. Athlete or not, I think we use a lot of upper trap. So either you're behind a computer using your upper trap a lot, or a lot of times people do this shoulder shrug thing because they want to have muscles like John does. So they overdevelop their upper trap. Their upper trap is a little bit more talkative. So when with that exercise, I can see the upper trap coming into the picture to do the initial pulling.
Oh no, I don't want no pull up. I just want you hanging from the bar.
Well, but then at some point you gotta. All right, so let me add to this, and then I can agree with you.
Okay.
So as you're hanging, at some point, okay, if they're hanging, what should they do with this part? So let's hear this part first.
What I usually coach is hang from the bar, and then I coach them to breathe into their belly or breathe into any places they feel tight. So if I'm feeling tight in my lats, I'm going to focus. I'm going to take a deep breath in and imagine that I'm breathing breath into here and it's expanding up. If that makes sense.
Okay, so how about this? If you're hanging from a bar, So you're hanging, but you're, correct me if that is not what you mean. So we can engage the muscle to hold, or we can basically hang on the tendons. So if I'm hanging and I'm just hanging, really I'm just stretching my tendons. But then if I'm hanging and I'm really, am I pulling down with the side of my chest? I think that's what I'm doing.
See,
right?
that would be the next step. I'd get them, because like I said, if we're talking to the person who's stuck, they're stuck in retraction, they can't move it, those scapula can't glide. If I want them to hang, I feel like they're not going to be necessarily hanging on their tendons because they're already stuck. Their rate limiter, or their point of indication, is going to be their mid back. So that's
They're going to go into this.
Yeah, and so if we're holding it, if I'm having them hang there, and we're speaking to that person who's stuck, I feel like where all their attention is going to be held is going to be, for the most part, that area. And I'm trying to get some more movement in that area, if that's what I'm...
So then let's talk about ideal positioning.
Okay.
I think that would be a good one. If you're hanging from this bar, make sure your neck is not in front of your body.
Yes.
Make sure your chest is not sticking out. So even if you're here, when the muscle is not strong and you're giving the command to your brain, hey, I want to do this for this long or for these many times, then it's going to give it to you regardless of if it's using the right muscle or not. So be watchful. So that means that's your imaginary checklist. Your neck cannot go anterior, it can't go in front of your body, even though you're here. This is not a neck muscle. It's like one of those ab exercises. The next day it's not your ab, it's your neck that hurts. You know? So we've all been there. So you're hanging there. You're not your neck is not anterior in front of your body. You're not pushing your scapular shoulder blades towards your spine. You're also not hyperextending your back.
Yes.
More than likely, that's what you're doing. And then forget about, how about if they engage their lower ab to bring their legs up? Where's their legs? Hanging?
Just hanging.
Okay.
Just hanging.
I like that, because if you're trying to save up time and want to do a couple of exercises, don't even waste your time, because you're actually doing more damage, wouldn't you say?
Yeah, that's why I usually go to the pull-up first, because if I say that, if I'm not there and I tell them to do, say, a prone push-up, and they're not doing it right, then we're reinforcing that bad movement pattern. If I tell them to hang and they're not doing it right, that's kind of, I don't see us moving through that range of motion, so I think that the damage that could have been done is a little bit less. That's just what I'm saying.
So I can see that. So you're looking at the damage point, and then which one does less damage if they're not doing it correctly.
Yeah, just the risk for reward. This prone push-up might be better, and it might be more beneficial, but if you're doing it wrong and I can't watch you, then what could the potential risk be? That's just why. The risk for reward is a little bit more favorable, although it might not be as effective putting it from a bar.
So in my practice, when we've gone through the different rehabs already, and now we've done the correction of the brain pathway with brain-based neurology, with the developmental kinesiology. We've already engaged all the muscles involved in the shoulder area in this case, and now we're kind of trying to up the game, especially in athletes. I like the prone push-up.
Yeah.
But I'm there, and I can see if they're doing it correctly or not. So just to cover what that means, you go into it's like a plank. Essentially, it's like a plank, and I like them to be on their elbows. So you go like just a standard plank, and then it's as if both sides of you hanging from the ceiling. There's a rope there, and it just lifts it up in this region. So that's essentially, but then I'm watching it, and it's very easy to do it incorrectly.
Yeah, definitely.
For sure.
It's easy to do it incorrectly.
You can engage your lats, for example, to do a lot of talking.
Exactly, and we don't want overactive lats, because that can bring in more host of problems, but exactly, you could easily do it incorrectly, and say we show you how to do something, you still would be better off having a set of eyes on you, because I'm a victim of this too. If I see someone, if I'm trying to do something from say YouTube or from us, and I think I'm doing it right, I might be doing it right, but I could be doing it wrong. You still aren't very sure. So it's really good to have a set of eyes on you. Say, no, actually you want to feel it here, and then some palpation, and then you're gonna have that feedback that you want.
And so if you're wondering, well, why in the heck, so are you telling me not to rehab? Because I mean, I don't have extra set of eyes. What do you have to say to those people?
But try it. I mean, try it. If you do it and it feels right, and then you don't do it, you get up, and then you're like, oh, I'm standing up a little straighter, my back doesn't feel as hurt, then there's a good chance you probably did it right. But on that same token, if you do it and you're not sure if you're doing it right, and you get up and I didn't feel much, man, like I don't know if that really helped me, then that's when I say you should probably either try again and try and figure out what you did wrong, or seek out a set of eyes to help you.
So my reply to that is, and this is how I go about doing it. If I'm doing something new, and you may think, well, geez, shoulder exercises are nothing new to me, but obviously you've injured yourself, so you did something wrong. So it is worth spending the time and investing your money, getting yourself eyes for hire.
Yes.
A couple of times, and maybe have these different issues. I mean, that's the key, going to the experts, because then we're like in my practice, and I'm sure John does the same, I'm not introducing something new. It's something that your body's designed to do. We're just making sure you do it. So it's one thing for you to learn something new. It's another thing to go into the archive room and pull the file that you haven't accessed in so long. So once we introduce, or we coach you, pun intended, we coach you to do the exercise correctly, you will know, and you will be able to repeat it much better. And with repetition, then you know what to look for, you know where you fail, and then the experienced set of eyes will be able to basically help you see where you go wrong, so then you do it correctly. Now, John, from a perspective of shoulder injury, and when we say shoulder, like I said, it's shoulder, but shoulder and upper back in this question. What is the most common type of injury you see? We see where the most common type of weakness is, which is, I really think, serratus anterior is, but how about injury? What tendon in the, I'm sure rotator cuff is the answer.
Yeah.
And obviously the neck, because your neck it comes close proximity to your shoulder. It's actually engaged because your clavicle, your what's this thing called? Collarbone gets connected, and it's one of forms the socket for your shoulder joint, which is a ball. So, and your neck muscles are connected here as well. So they go hand in hand when it comes to treatment. But what is the most common type of tendinous injuries that you see with shoulder issues?
So I'm gonna throw a little disclaimer here. I see a lot of impingements, and I see a lot of pathologies with the shoulder. Excessive internal rotation, not a lot of movement, very, very sticky scapula. But I honestly have not seen too many injuries, just because I feel like a lot of coaches don't really load the upper body as heavily as the lower body. And so I haven't seen those acute injuries. We're obviously working on rehabbing it and preventing injury by doing these different exercises, but for most athletes, I mean, the upper body and like pushing and pulling, like loading it isn't that big of a priority.
In my practice, I see a lot of, when it comes to extremities, which is shoulder, elbow, wrist, hips, knees, feet, I would have to say shoulder injury is the highest number of injuries I see.
Yeah.
So that's because I'm at the pathology end of it, you're at the rehab or activity, you're dealing with athletes. So shoulder injuries, the most common types of shoulder injuries are supraspinatus. Supraspinatus is right up here, right above the top portion of your shoulder blades. And I see a lot of tendon issues there because of the way the tendons of this muscle are configured, because it's not like going from one point to another. It actually goes under the clavicle as it, I don't know if you can see this. So under your clavicle, it goes under from back here, it goes under and gets attached here. So it's very easy for it to get pinched and irritated, and with the rolled forward situation, it just basically, it's overstretched, it's dry, overused, and not happy. So generally speaking, since we talked about dry tendons, for all soft tissue injuries, when you have it or when you work out, it's so important to up your protein intake and vitamin C. That's what the tissue needs to repair itself. So you don't necessarily have to have an injury, but if you work it out, you need to repair some of what you have used. This is, of course, on a case-by-case basis. For example, if you've got gout, protein intake may not be your thing, because obviously it's going to backfire. How about the upper back area? Do you see any injuries or weaknesses?
Definitely not being able to protract our shoulders forward and get it forward. Because with the upper back, like we discussed earlier, retraction is what we want. We're always coaching retraction because we want a stable scapula, but protraction is equally as important. And I feel like a lot of people aren't able to really push something away without using our chest, if that makes sense. And so I feel like that I've seen that lead to a lot of imbalances, a lot of it. And,
like I mentioned before, the balance on both sides of your forearm and your arm play a huge role in effectively using the right muscles to deliver the right move. So do not disregard giving your forearms and your arms and your shoulder, front and back attention to stretch it. Now tell me what you think of this, John. I really am not so sure how big of a fan of stretching necessarily I am. I'm kind of changing my position. I'm going hardcore after people stretching versus people actually holding a pose correctly and properly, in which case that automatically encourages a short muscle to get elongated to some degree. What are your thoughts on that?
I would say I would have to know what we're talking about, what we're wanting to stretch.
Are you telling me I was vague? Is that what you're telling me?
I don't know if I'd say never stretch or stretching is bad. I'd want to know what we're stretching and why.
Well, I think people overstretch.
Okay.
And then I'm not so sure what I see in practice. Again, I'm on the pathology end of this. I see how people, when they stretch, they're really going beyond stretching the muscle that's the culprit.
Okay.
So for example, if you're stretching your, let's say, lateral deltoid, maybe your teres muscle, and you're doing that, I see so much of this rotation. Now, you know, you're just rotating. You're not really stretching the tight muscle. But if you are holding a specific pose, developmental kinesiology is what I'm referring to. If you hold a specific pose without really loading on it or going beyond and go do these extreme moves, now you're actually activating the right muscle holding the pose.
Okay.
So holding a pose is a lot more difficult than people may imagine.
Yeah.
So does that make sense?
Yeah, I would agree. I feel like the purpose of stretching, for the general consensus, I feel like if we were going to stretch, is to get a little more range of motion in our muscles, but I feel like that can be, like you said, a little misconstrued. If we want to get more mobility instead of flexibility, if we want to get mobile, we need to be able to generate force through those ranges of motion. So if we're just stretching and we're not training that range of motion to be stable and strong, then we're kind of just opening ourselves up to more injury. For instance, I would not have somebody necessarily stretch the low back if it's tight and if they've just injured it. If it's tight, it's kind of protecting you from something else is going on and it's reacting to protect you. It's a protective measure. I'm not just going to stretch it because I'm not addressing the problem.
Exactly. That's exactly. Thank you so much, Baba. That's exactly what I was referring to. It's very easy to get busy thinking you're doing yourself good, but in reality, you really are not. So I think going about this is as you've injured yourself and you're trying to initiate the rehab, going about and cautiously, it's almost like looking at a movement frame by frame, and you go slowly at it and you hold it. That's much more effective, less prone to re-injuring yourself, and you actually start seeing where you went wrong. So I think that's the key. You know, John, as we're doing this, I feel that in real life, outside my office, we see a lot of, really, I see a lot of upper back, neck, shoulder failure, posturally speaking. So I'm wondering if we should do we should break it down to muscle by muscle, because I feel this one interview kind of went in a broad overview as to what can happen, but then maybe how to rehab supraspinatus, infraspinatus, basically rotator cuff muscles.
Okay.
So I think that maybe we want to kind of break it down into that. How do you feel about it? He better say yes.
I mean, that sounds good. With the muscles of the rotator cuff, I think a lot of people are a little misguided in how they strengthen it. I go to the gym, and I just see people moving through.
Special lateral deltoid.
Yeah, they're not really doing much. They want to tell themselves that I'm doing external rotation, but they're exactly, they're just kind of doing busy work and not really accomplishing much. So I think that's actually really beneficial.
I think that's what we'll do. So since I basically proposed to him right here on the live on the video here, I think he's being nice.
So I mean, yeah, I see it all the time. One thing I guess if I want to give people an actionable who might, if you are the person that might be just doing, this with a couple of weights, not doing much, one thing that I would say is, staple this elbow down while you're doing it. If this is moving and our chest is moving, we're not doing much. If we really want to target, the muscles of our rotator cuff, don't move this elbow. So one thing I do is I roll up a towel and I put it under the armpit, and I tell you to squeeze it, and then we'll go through it. And just don't try and get extra range of motion. Don't try and force anything. Don't let your elbow move, and move as far as you can. Come back under control.
So it stabilizes the elbow. So don't squeeze it in a sense that you're activating your triceps and probably some of biceps.
I should say don't let it fall.
That's right. Big difference there, right? Anyway, well, it looks like we've reached the end of our time. Thank you so much for doing this. I'm so excited that you've agreed to do these interviews so we can cover some bases of basic concepts, and with injury prevention in mind. Not injuring yourself is so much easier than anything else. And so I believe I asked all the questions I was asked by people who were not able to attend the live interview. And if you have any questions for John or I, please don't hesitate to email me. I'll make sure that I'll put all the contact information at the bottom of this video. And thank you, John, for being part of the team.
Yeah, thank you for having me. I'm always open to questions. I'll never turn anybody down if I don't. But if I don't know, I'm going to tell you I don't know.
Good.
But yeah, if you have any questions for me, let me know, and I'll help you as best as I can.
Thank you so much.